So what led to the creation of this unit is just the exceptional care that our team delivers in neuroservices. With the combined efforts of our physicians and our staff, we were identifying this need and we're here to meet that need. So we've decided to expand and grow our Neuro Critical Care unit.
Well, the Neuro Critical Care has been a dream and a vision of Dr. Shaw, of leadership within Franciscan for several years, but we've had a great dedicated group, and I believe we've really come up with a really successful product to launch.
So Neurocritical Care Unit is what it sounds like. It is an ICU that is dedicated to patients who have neurologic diagnoses. The reason that we're so excited about building this is that patients who have those diseases, obviously that can be a very life-threatening problem. And at Franciscan Health, they've been dedicated to building the best care model for our patients. And obviously with neuro and neurosurgery, that's why the Neuro ICU and the Neurocritical Care Unit was designed.
So this unit will have staff nursing who is specialized in neuro care. A lot of times they need every 1 hour checks, every 2 hour checks, and then it also allows the neurologists, the neurosurgeons, the neuro IR docs to know the staff, who to contact to get that good patient care and communication.
So when someone is diagnosed with a neurologic problem, there is so many facets to their care. From their initial presentation to the hospital to make sure that they're getting worked up appropriately. We have the best technology for imaging and diagnosis and treatment that may be required. Most patients with neurologic diseases have some requirement of rehab services. That may mean acute inpatient rehab, which is also housed in the hospital here, or outpatient rehab. And so that's also offered at the hospital. So when a patient is seen here for a neurologic problem, it starts from the beginning, but we want to make sure that we have given them the best opportunity to recover and go back to a normal life throughout the whole spectrum of care.
So we have a really selected staff that have a passion and interest in neurocritical care, and so we'll continue to build on the skills they already have. Many of them have years of experience, and we're excited to bring them to our unit.
So we've had a large push to patients, CMS, to get patients into the ER as soon as possible. Time is brain. So a lot of times that opens up the ability to give clot busting medication. You know, if we see a clot that we can go get within a timely fashion, we can do thrombectomies.
If I were a patient that had a neurologic problem that required critical care, I'd want to go to a dedicated neuro ICU. And on the south side, we're the only ICU that's dedicated to neuro. And I think it's important for our patients, but also our EMS providers and our partners around the community to know what we offer. And they should be confident that if they bring a patient here, that they're going to get the best care possible.
Very excited. One of the precursors to this is we started our neurocritical care ambulance service last year, and so that's a Franciscan transport system that goes out to facilities, outreach facilities, to get patients and stabilize them, bring them to us for transport. So we think that's a very, very important piece of our new neurocritical care unit.
Franciscan Indianapolis is a beacon on the south side. We are offering a lot of procedures that aren't offered on the south side, with stroke, thrombectomy, neurointerventional care with subdural hematomas. So I think more and more people will be more aware of, ooh, this is where I need to go to have the things done quickly in a timely fashion that impacts the outcome.
The benefits of having this unit is to have a unit designed and led by a team of exceptional neurosurgeons, our neurology and our nursing staff and other clinicians. That helps speaks to the focus that we have on neuroscience programs here at Franciscan Health Indianapolis. With this foundation, we'll be able to then further advance the care that we do for our patients in neuroscience and offer additional services and even more advanced care to our patients.
I think, again, it's going to open up everyone's eyes in the community to what we can do. I think as the technology expands, there'll be more procedures we can do so that we can continue to bring in those more complex patients.
When a patient is given a severe neurologic diagnosis, we know it's a long road to recovery for many. Obviously, state-of-the-art care and the best treatments make a huge difference, but we also do not underplay the importance of their family support. Having this unit in their community where families are able to visit their friends, and their social support network makes a huge difference in their outcomes. We prioritize that here in the Franciscan Neuro Critical Care Unit.